Hello, and welcome to the Journee Continues Podcast. I'm your host, Tamisha Little. Here on the Journee Continues Podcast, we bring you conversations centered on recovery, behavioral health, advocacy, civic engagement, and the people making a positive impact in our community. Today, we're discussing an important part of the recovery journey that often happens behind the scenes, but plays a critical role in long-term success. The role of nursing in healthcare and supporting individuals with substance use disorder. I am pleased to welcome Amie Lewis, licensed practical nurse and nursing supervisor with SHARE. Through her work, Amie helps individuals in recovery addressing their medical needs while supporting their overall health, wellness, and healing. Amie, thank you for being here today. We're grateful for the opportunity to learn more about your work and the important role nursing plays in recovery. Let's begin by learning a little more about you. Please introduce yourself and tell us a little bit about your background and what inspired you to become a nurse.
Well, thank you for inviting me, Miss Little. My name is Amie Lewis, as you said. I'm a single mother of four. I have three sons and one daughter. Um, I've always been interested in nursing, but I became more interested in substance abuse and mental health. I think back in 1992, I worked at Doctor's Hospital on Jefferson. Some people may remember Doctor's Hospital. And that's where I first started with substance abuse and mental health. But my first aspiration was to be a dancer. But after watching nurses, to me, they appeared to be as angels in the white uniforms and the white nursing caps. And that's just what inspired me to continue to go to school to be a nurse.
Can you explain your role as nursing supervisor at SHARE and what a typical day looks like?
Well, typically I hit the floor running. As soon as I get into the building, I hit the floor running. Some days is hectic and some days it's not. A typical day is several knocks on the door. The clients come to the door with all kind of medical questions that they ask us. From can I cut my toenails to I need to get a primary care physician. I need to find mental health help. We try to give them as many resources as possible. But my main goal is I try to make them establish a primary care physician because not only are they here to take care of their substance abuse, but they have to take care of their whole body. And the whole body plays a whole role, a continuous role in their recovery. So that's my job. And as I say, some days it get a little hectic, but I love it.
Okay. Many people understand the counseling side of recovery, but may not realize how important nursing care is throughout the recovery process. How does nursing support individuals recovering from substance use disorders?
Well, the nursing aspect or the medical aspect of recovery is quite critical because at that point, if we're doing a continuum of care, that means the whole body, we have to have the mental health as well as the physical health intertwined with each other. And that's all for the brain power. And in order to get that to work, we have to get them medically stable as much as possible, along with understanding what's going on with their bodies, understanding why the medication may be working or why it's not working. But it has the medical and the mental health has to intertwine with each other. And that's the goal we be trying to reach with them is to make sure that they understand that that's the goal.
Okay. What are some of the most common medical or health concerns you see among individuals entering treatment?
Well, as I previously mentioned, most of our clients don't realize that they do have a primary care physician. Most of them have not seen a primary care physician in months and maybe years. So I try to establish the importance of getting a primary care physician so that they can understand what their body is going through, what changes their bodies are going through. A lot of our clients are older 40s and 50-year-old that haven't taken care of themselves, and they're used to feeling a certain way, and now they're starting to feel a little different since they're coming into recovery. Their bodies are changing every day because they're getting their bodies back on track. So I try to make them understand what's happening from one step to another as to recovery, as I said, so that they understand that recovery works, but you got to do it from your head to your heart. It has to all intertwine together.
Thank you for mentioning that. When it comes to our next question is, how do physical health and mental health work together during the recovery process?
They intertwine in each other, and it's important that they understand that maybe they have neglected themselves for a while, and most of them we do see have neglected themselves, but they have to be the most important to themselves. They have to make themselves the number one person in their recovery and their physical health. That has to be first and foremost. And I try to make them understand that if you have a primary care physician, that particular doctor is there to help you, but you have to open up and be honest. You have to be honest. Don't be afraid to admit that you are in recovery. Be proud that you're in recovery. Be proud of that. That's a big milestone for some of them to admit that they're in recovery. And I encourage them always to admit, so that when you go see your doctor, he won't give you anything that's a mood altering substance that may trigger you back into using. So as I said, it all intertwines with each other.
Okay. How important is medication management in helping individuals understand their medications?
A lot of them don't have primary cares, and once they start going back to the primary care, I try to make them understand that the consistency of taking the medication is what makes the medication work. That it's not just here and there. You have to consistently take the medication to get it into your system. Most medication takes anywhere from 7 to 14 days before it therapeutically begins to work. So I make them understand that you must take it every day, as close as possible as you do every day. Take it every day. And if you forget it in the morning or forget it at the time you usually take it as soon as you remember it. But the consistency of taking the medication is what makes the medication work. I try to make them understand why they're taking the medication and what the medication does for them.
Recovery involves much more than treating symptoms. It also requires compassion, trust, and meeting people where they are. Recovery can be physically and emotionally challenging, as we are discussing. How do you build trust with individuals who may have experienced trauma or stigma?
Well, as you said, honesty. Honesty is the best policy with anything that you do. You have to be you have to be truthful with them. Don't sugarcoat what you're saying. I mean, we don't want to make them fearful to open up to us, but we want them to be comfortable enough to feel like what we're asking them, they're freely able to express how they feel. I usually maybe make a joke with them or so, get them a little eased into the assessment, and it opens them up sometimes, but I try to meet them where they are, and I make sure that they understand that I know physically what you're going through, and I'm here to help you. Just let me know. And I also ask them that if they're feeling something that they haven't felt before, to seek out staff and come to the medical department and let us know what you're feeling. I always try to make them understand it. Come and knock on the door, and you got a question, see if we can answer it for you. If not, then if you need to go out to the hospital or to the doctor, then that's what we'll do.
Okay. What misconceptions do people have about individuals living with substance use disorders?
Well, there's not a lot of negativity around people who have a substance abuse disorder. And I think that's because they don't really understand that the substance abuse disorder is just like any illness. It's an illness like anything else that a person can have. I've heard people call people real bad names. They may call them very negative names. They look at them funny. They are not trustworthy of people that they feel have a substance abuse disorder and things like that. It's real hard to get them to understand that that's not the person you were. You can always change. And I'll give them respect, and I always call them by their name. Or I will say, what would you like me to call you? Would you like me to call you by your first name or your last name? I always lend respect. I always give them the respect that they deserve.
Thank you. What have you learned from the individuals you serve that has impacted you personally or professionally?
I've seen a lot of success. I've seen a lot of successful recovery clients come back looking entirely different. I mean, smiling. They remember me. All of them come, Nurse Amie, and it impacts me because it makes my heart glad to see that we have done something along that line to help them get to that point. The share had a part in helping them get on that road. We build that foundation and we try to make them understand that's just like a house. Once you build that foundation, now you have to start building on it. Know your triggers, know what coping skills you have. And it's good to see some of them come back looking entirely different than they did the day they came through our doors.
Yes, ma'am. We're going to transition over to education and prevention, which we know they are powerful tools that can help people begin or continue their recovery journey, as you said. What advice would you give someone who may be hesitant to seek treatment because they're afraid or embarrassed?
I would tell them that give it a try. Give it a try. Let's see what happens. You can never say you don't want to do something if you haven't tried it. Give it a try and let's see how you feel. Sometimes people rather do remote, now that everybody's on Zoom and do remote, that we can offer options like that. There's teledoctor, there's teletherapist now. So some people may not feel comfortable going into a crowded area or maybe one or more people in the area talking about themselves. We can offer that to them. There's one-to-one therapy with their therapist. There's a lot of different areas that they can go in when they do feel embarrassed about, but there's nothing to be embarrassed about. And that's what they need to understand. Once they start to understand their recovery, that embarrassment part will eventually go away because they are beginning to be proud of themselves that they were able to continue their recovery.
Okay. If someone watching today is struggling with substance use or has a loved one who is struggling, what message of hope would you like to leave with them?
Message of hope is that there's always hope. I would never give up. Never give up on any individual. As long as they have the willingness to come to us or come to that loved one and ask for help, I would never discourage that person from seeking help from anyone, family, therapist, whatever. I would never just encourage them never to not seek help. Always try to seek help.
Okay. Is there anything else you'd like to share with our audience to know a little bit more about recovery, nursing, or services available through Share?
Yeah, well, Share has a lot of resources that we offer the clients. Share has been in existence a little over 50 something years. And we now have the engagement center, which is across the street, the engagement center, and our ECHO program. Our ECHO outreach program goes out in the community. We go to shelters and different places to encourage people that want to come into recovery or want help. We go out and we bring them back. So the engagement center is like a 23-hour hold. We The police can drop them off. It's a walk-in. It's open 24 hours a day for 7 days a week. They can walk into that engagement center. They can get a shower, resources. They can get a good meal, a good night's sleep, and resources are offered to them as far as going into treatment, going into outpatient treatment, whatever the option is that they are looking for, we are available to give them those resources.
Amie, thank you for joining us today and for sharing your knowledge, experience, and compassion. We truly appreciate the work you and the entire SHARE medical team do each day to support individuals on their recovery journey. To everyone watching and listening, thank you for joining us for another episode of the Journey Continues podcast. If today's conversation encouraged you or someone you know, please like, share, and subscribe so we can continue bringing meaningful conversations to our community. Until next time, I'm Tamisha Little, and remember, the journey continues.